because 99% of the time anyone does hip work, what are we doing it in? Hip flexion, right? We're always talking about how well does your capsule move up here, but never how well does your capsule move down here. So we're gonna follow the rotational before linear principle, do internal rotation of the femur within hip extension, right? And then do ER in hip extension. And then we're gonna do linear hip extension. So what we're gonna have you do on the mat, you're gonna kneel, get into hip extension, rotate pelvis around femur. So femur still, pelvis is rotating. We're using this to lock you down. You have a pull for support, have a hand for support. Hip extension, rotate. I wanna make sure you're not rotating at the spine too much. All at the hip. Right knee down. So, a couple things. Find hip extension, pull away from the box. Now, femur's right here, right? It's still. Rotate your pelvis towards me and find internal rotation while in hip extension. Yeah, so you can turn your whole torso, but I'm looking for you to find a capsule stretch. So the hips extended, right? You have the glute contracted, and then we're rotating the entire pelvis around it. Every other time we're doing hip work, it's femur and pelvis. It's never pelvis around femur. Do we have a capsule stretch? Okay. And so I'll put you on a timer. It should feel like deep bone stretching, right? Not exactly muscles stretching. Keep the glute tight. Let's hold that positioning. I want you trying to maintain a consistent breath. In through the nose, out through the mouth. We're maintaining hip extension. Can you tilt a little bit further to me? Think about rotating this a little bit more. Right there. You have a deeper stretch there. Breathe into it. You're shallow breathing, man. Try to relax. All right, we're gonna hold that for 2 minutes because we're doing pails and rails, progressive, regressive, angular, isometric loading at end range. After we do pails and rails here, we're gonna do end range liftoffs and eccentric loading. So we're gonna do a combination of the entire length loading progression, starting at length, then going to length. So you're at a minute, you got a minute left. Keep breathing into it. Keep maintaining hip extension. You're squeezing the butt forward and try to get a little bit further into that. And you're not losing the capsule stretch. Okay, hang out there. You got another 35 seconds or so, and then we'll do our isometrics from there. 20 seconds, maintain that end range hip extension, and then keep thinking pelvis around femur, right? That femur sitting still, and it's the entire pelvis rotating around it. Awesome. Now, hang tight. So for those watching the video, it is super important that he does not come out of the end range. So when you start contracting, I don't want the pelvis moving. So without moving this at all, think foot into box, and you're thinking about externally rotating, right? Rotating this externally, trying to push the foot into the box, but the pelvis isn't moving. Did the sensation change from a stretch to a squeeze? You have a contraction, not a passive stretch anymore. That shift in sensation is what you're chasing after. Maintain that. I got you on a timer. Don't overdo it. You're gonna give me like 50, 60% effort for 45 seconds. And then for the last 15 seconds, we're gonna go balls to the walls and hit the nail on the head. So ultimately, you're in this position and you're trying to rotate into the box, but you can't because the box is blocking you. You're maintaining full hip extension. Your glute is tight with your pelvis posteriorly tilted, and you're still trying to drive through here by rotating. Start dialing it up, but don't lose the end range. You're staying where you're at. Give me another 15 seconds, ramp it up harder. Go. 10, 9, 8, 7, 6, 5, don't lose me, 4, ramp it up, come on man, 3, 2, 1, relax, don't move, don't move, don't move, just relax. You don't need to jump into the rail, just relax. We're keeping you at length. The rail, the regressive angular isometric load, instead of pushing into the box and externally rotating, without moving this at all, internally rotate and try to pivot your foot away from the box. Yes, do you feel your hip contracting right there?
Yeah.
So you're trying to swivel femur within pelvis. This is not moving. I don't want to see your pelvis dumping to the left. Maintain that. Keep trying to pull away. Do you have the contraction?
Yeah.
Good, hold the contraction. Your foot coming off the box does not matter. I care about you squeezing and initiating internal rotation of the femur. Hold it, hold it, hold it, and relax. Don't move a thing, don't move a thing. Breathe, man, try to relax. So that was your pails and rails, right? For internal rotation, hip extension. We're now gonna turn this into eccentric loading, okay? So what you're gonna do is rotate your pelvis this way, hold on to the pole. Find hip extension, pull away from the box. Squeeze your butt more. Tuck your pelvis under you, that right there. You have hip extension. Get your foot here. Now while maintaining hip extension, squeeze your glute more. Start pushing your foot into the box. Do you feel your hip contract there? So you're staying in this position and you're trying to externally rotate into the box. Now, without losing the tension here, you're still pushing. Start rotating your pelvis to me, slowly. Good, keep rotating your pelvis to me. If you need to bring this arm to the box, you can for support. Keep rotating the pelvis so you're constantly driving external rotation and you're rotating the pelvis internally relative to it. So keep pushing, push harder, rotate your pelvis to me, man, rotate your pelvis to me. Keep going, push against the box more, crush my hand. So the whole thing is dumping to me as you push. Now reset, rotate back facing the wall here, back there, stay put, find hip extension, squeeze your butt. You're almost done, we're gonna do 2 more reps there. Full hip extension, tuck your butt forward more, start pushing the foot into the box. So now you have external rotation, you're contracting. While you're contracting into the box, the pelvis is rotating. Keep pushing, break my hand here, harder, into the box. Keep thinking external rotation. Come on, get it cramping, you're in hip extension, your hamstring's short, come on. Rotate the pelvis more, Good, reset, face the wall again. Come out of end range, right? You notice you're going to length, right? First we did it at length. You were at the very end range, then we paled and railed. Now you're at mid range, and you're going to end range, okay? There's a difference there. You need a second? Catch your breath. All right, find hip extension. Start pushing into the box. You have the hip contracting.
Yeah, we got it.
All right, you have the contraction. Maintain that contraction by pushing into the box. You're externally rotating, right? All you're doing is driving ER of the hip. Yeah. And as you're pushing in, you're rotating the pelvis around the femur. That's all you're trying to do, but there's still a ton of tension here. Go harder, go harder, go harder. 3, 2, 1, relax, don't move a thing. Try to pick your foot up off the box now.
Wow.
Just try. You see how you can't. That is a rail because you can't actually own that. Relax. I want you to come out just a little bit, right here. Now pick your foot up off the box. Nope, not up, but out towards me. Rotate. Plantar flex. Good, now relax it. Here. I want you doing an end range liftoff. Okay, so you see where I have you? Keep your ankle plantar flexed. Point the toe more. Yep. Now without moving this at all, internally rotate and pull your foot off the box. Boom, 1 rep, back in. You see what we're doing there?
Yeah.
Internally rotate, slightly. Just a little bit, rotate further, foot to me. 2, good, plantar flex. I don't want you using your hamstring and knees too much. Rotate to me. 3, good, reset. Again, bring the foot back to the box, reset it. Come on, come on, you got 2 more, 1 rep 3. Rotate off the box. 4, good. Last one, foot back to the box. Lift off again. And relax it. Make sense?
Too much sense.
So for viewer's sake and your sake, keep an eye on this. We had end range IR extension. I rotated my pelvis relative to the femur. You paled by pushing into the box. You railed by pulling off the box. After we did your pails and rails, your input 1s, we went ahead and did eccentric loading where you come out of end range, you begin pushing into the box, and without losing tension, I am now rotating my pelvis while driving ER. Okay, I'm loading myself to length rather than at length. At length is end range contraction. To length is contracting to end range, not at end range. After we did your eccentric loading, we pulled you out a little bit, just far enough where you could actually clear the box. Because if I kept you here, you couldn't clear anything. That was end range. I'm trying to have you just shy at end range so you can actually fill the gap. Yes, you can actually squeeze something and actively pull off of it. End range liftoff is range you actually can manage. If I had you all the way here, no matter how hard I pull off, I can't. But if I come to about there, I am actively doing that. Like my system can truly do it. Different than a passive range hold, different than a rail. Does that make sense?
Yeah.
So we just had you do IR extension. We're gonna do the opposite and get you into ER extension. So we're finding hip extension. You're rotating pelvis, pale, drive in, rail, rotate back. So ER, external rotation of the hip while in extension. Every other time people are doing hip stuff, it's always in flexion.
Always.
Pigeon stretch on a table, the 90-90, you're doing an extension now. So right knee down, yep. Pull here, bring this foot over this way more. Yeah, man, further, 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 further. Keep going, keep going. So do you see how we're in hip extension here? Bring your knee towards the box more, this knee. Yeah, pull away from the box now. Bring this foot out to me, right there. Pull away from the box. Use your arm and push away from it more.
From here?
Right there, man. Yeah, you see what we're doing there? So we put you in an externally rotated position. Get hip extension, tuck your butt under you. Are you getting a stretch?
Yes, I am.
Okay, hang out into the stretch. Just hang out in the passive stretch for right now. So again, we have your femur completely still, and now you're rotating the pelvis towards me, and you're creating relative external rotation of the femur. And we have a good deep passive stretch. Breathe into it, try to get a little further. So we're gonna do the same thing, for example's sake, 2-minute passive stretch, 1-minute pale. A good rule of thumb is that for the 2-minute passive stretch, that's to establish passive range, and then we need to do active work to reinforce that range, which we did for internal rotation as well. Good rule of thumb is a minute for the pale, 45 seconds moderate intention, and then 15 seconds of all out 100% effort. Our Kel here is particularly tight within external rotation and hip extension, so we're gonna give him enough time here to truly let that open up.
My glute is flickering.
Breathe, man, breathe. Try to relax, keep driving a little bit more ER, get that pelvis rotated a little bit further. You're coming up on the 2-minute mark. So I want you to see though, you're pale, don't move. You're here. What you're gonna do is push against the box and you're trying to internally rotate. So if this doesn't move at all, start driving this into the box. Push against me. Do you feel the stretched area now contracting? The sensation should have shifted. Pull away from the box a little bit more. Pull your butt away from the box. Then keep pushing there.
There it is.
Beautiful. So all you're trying to do is push the foot into the box. You're trying to internally rotate your femur. You're trying to rotate it towards me and driving here. But at no point are you losing the hip extension. The hip extension isn't dumping. The pelvis isn't dumping to your right. You're maintaining that. Hold it. Don't lose it. Push against me. I got you on the timer. You got another 45 seconds. Keep letting that burn. Keep letting that burn.
What percentage are you at?
50, 60%.
Okay.
You're going for 45 seconds. Last 15 is going to be all out effort. Get ready to start dialing it up. 3, 2, 1. Give me 100% effort. Go. Do not lose the hip extension. Don't lose the posterior pelvic tilt. Don't lose me. Posterior pelvic tilt more. Tuck your butt under you more. Keep pushing against me. Harder, man. Harder, 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 harder. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Don't move a thing. Breathe, relax. Rotate your pelvis to me a little bit more. Now without moving the pelvis at all, pull your foot off the box and think, can I externally rotate my femur further so his thigh is rotating this way and he's trying to pull his foot off the box. Hold, hold, hold. Keep rotating, keep externally rotating. Hold it. Don't rotate though, don't rotate the pelvis, don't rotate the pelvis. You see how the pelvis is dumping to the right? Keep it there. All in the femur, all in the femur. Give me a little bit more. 5, 4, 3, 2, 1. Relax, don't move a thing. Get back in position. You found end range here, right? That we just did at length. You're in a stretch, and then we did isometrics. Now we're gonna go again into eccentric loading and go to length. So you're gonna rotate out of end range to about
Taking my foot forward.
there. Yeah, you can shift that over a little bit right there. Now you're not as deep into end range.
Right.
Find posterior pelvic tilt, hip extension. Start driving your foot into the box. Push against me, yep. Do you feel your hip contract?
Yeah, there you go.
Okay, you found it. Keep pushing against me and now rotate your pelvis to me. Maintain posterior pelvic tilt, pull away from the box. Keep pushing against me here. So you're driving tension, the femur's completely still, and the whole pelvis is rotating to me. Drive this to me, drive this to me. Come on, bring it around, bring it around, bring it around. Beautiful, come on, more range, bring it to end range. Yep, you can keep scooting your way over, keep scooting your way over. Push, push, push. That's 1 rep, reset. Big deep breath, go back to mid-range. Find hip extension, find posterior pelvic tilt, pull away from the box, pull away from my hand. Now push into me again, crush my hand. So again, you're at mid-range. Start pushing against me. You're contracting, right? You're thinking external rotation. Beautiful. Or you're thinking internal rotation rather. And as you scoot your pelvis towards me, maintain hip extension, keep rotating to me, keep rotating to me. Come on. You're driving in here and rotating your pelvis. Beautiful. Reset. 1 more rep. You're almost done. You got 1 more. 1 more. Come on. Find hip extension. Posterior pelvic tilt. Start contracting. So you're pushing your foot into the box. You're thinking internal rotation, right? You're trying to rotate internally, push into the box. Come on. And as you're pushing, your entire pelvis is rotating to me. Keep pushing. Keep pushing. Keep pushing. And the whole pelvis is rotating around the femur. Keep pushing, keep pushing, keep pushing. This is here and we're rotating internally. Come on. Come on. Come on. Squeeze. Push. 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 Don't lose me. Don't lose me. Don't lose me. And relax. Don't move a thing. You got end range liftoffs and you're done. Sit up tall. Keep it together. Come on. Keep it together. Keep it together.
He's a bully, dude.
Right there. Find end range. You have hip extension, posterior pelvic tilt. Pull away from my hand.
Ooh.
Now think, can I get my foot off the box? Externally rotate. Boom. 1 rep. Relax, relax, relax. Pull off the box again. 2. Beautiful. Back in. You see how you're actually able to manage that? There's truly usable active range there, right? We're trying to reinforce that. Maintain that. Think internal or external rotation rather. Pull away. Beautiful. Relax. 2 more. Get a little deeper. Come on, come on, come on. Foot off the box, foot off the box. Yep. All you're doing is trying to externally rotate deeper. Beautiful. Try to get the foot off the box 1 more time. And relax it. Make sense? You see how we did capsule rotation in hip extension? Because more often than not, all the hip work's done in the 90-90 and hip flexion. How often is anyone actually doing capsule work in extension? No? Never.
No.
Make sense? All right, take a second. We're gonna do 1 more drill, right? We did internal and external rotation. Now we're gonna work on linear extension. Here, find hip extension, passive stretch. If you wanna lean into it a little bit, you can, but I'm looking for you to find a stretch on your hip flexor, open side. Then we're gonna pale and rail from there. Okay, so this is to follow up capsule rotation, so linear works better as a result of that. Find hip extension, pelvis forward, dump this all the way forward, find this at length. Do you feel a stretch through here? Push this into me more. Squeeze your butt forward, push your hip into my pen. You feel a bigger stretch there. You have to be very deliberate in actually squeezing your glute. If you're not consciously, deliberately contracting your glute, you're not getting this at length. So hang out there, you're on the passive stretch, breathe into it, and the idea is that you can access a lot deeper of linear tissue, a lot more productively, because we worked on how well it can rotate in that space. Breathe, man, focus. Posterior pelvic tilt, hip extension, drive this forward, find more length here. Get as much length there as you can. Give me more. You have more, drive that hip forward. Lean back a little bit more as you do it. Find more length. You got 30 seconds of stretching. Give me a little bit more. Further. Pull away from my pen. Pull away from my pen. Give me a little bit more. All right, so people are often passive stretching their hip flexors. We're gonna add active elements to it, right? To reinforce that range, make it stronger, save the work. So without moving anything, you're about to pale. You're about to contract lengthened tissue. So don't lose the posterior pelvic tilt hip extension. Keep the contraction. What I want you to do now is think about driving your knee forward and sliding the mat to the pole. So you're ultimately driving forward, going like this. So if you're pushing against me here, you feel this went from a stretch to a squeeze, keep contracting against my hand. Drive your knee against my hand, slide the mat forward. You're on a timer. Keep creating tension for another 45 seconds. In 30 seconds, I'm gonna ask you to ramp it up, okay? Drive your knee forward more. Give me more, harder. Start ramping it up. You got 5 seconds, and I want 100% effort. Ready? 5, 4, 3, 2, 1, go. Maintain hip extension, knee forward, slide the mat as hard as you can, drive your knee into my hand. You shouldn't be moving at all, but a lot of tension's being driven internally as you try to flex your hip out of hip extension. You got 10, 9, 8, nice man, drive forward, 7, 6, 5, 4, 3, there we go, 2, 1, relax, don't move a thing. Maintain hip extension. That was your pale where you contracted lengthened tissue, right? Your progressive angular isometric load. The progressive tissue was squeezed at length. Now rail and drive your knee back, slide the mat back and feel your glute contract. Slide the knee back, find your glute. Squeeze your butt more and drive the knee under you and behind you, and you're ultimately going deeper into hip extension, right? So you went from doing this to now this and contracting your glute. Push off that if you need to. Slide the mat back, get the glute contracted. You can squeeze this harder, come on. This is too lax, it's too lax. Drive the knee back, find more hip extension. Slide the mat back even more. Yes, keep sliding the mat back. Try to shorten this. Your job is to squeeze this as hard as you can in the shortened position. First it was squeezing lengthened tissue, now you're squeezing shortened tissue. Drive the knee back, give me a little bit more. Keep pushing into my hand, drive into my hand. You got 10, 9, 8, keep squeezing, 7, 6, 5, 4, 3, 2, 1, and relax. So we talked about doing more than just passive stretching. To follow that up, we're gonna add more active elements. So we're gonna get you here, and you're gonna find end range hip extension and back down. It's end range liftoffs. Find hip extension, you're squeezing glute hamstring. If you feel lower back, try to fight that compensation, see if you can find your hip. Last drill to follow it up, and then we're done here. All right, on the stomach, head down. We're gonna keep you here, dorsiflexed. Okay, I wanna make sure you're finding glute, not lumbar spine. I don't want extension here. If you wanna tighten your stomach and flex the lumbar spine, that'll help. Now lift the knee up and find hip extension. Do you feel your glute contract there?
Yeah.
Okay, now come back down. That's 1. Bring it back up. End range liftoffs. You're at end range hip extension, and you're contracting, trying to get your femur in the backside of your pelvis. We feel the glute ham tie-in contracting, and now bring the foot down. Let's get a set of 10 there. That's number 2. Back up. Number 3, clear my hand. Get as high as you can with the glute squeezed without compensation at the lumbar spine. Come back down. Number 4. Bring it back up. Clear my hand, heel to the roof. Squeeze the glute, squeeze the hamstring. Back down. Beautiful, come back up. All the way up, and no extension at the lumbar spine. If we're getting extension at the lumbar spine, that individual does not have enough hip extension to perform this drill. Bring it back up. You got 5 more, man, 5 more. Squeeze the glute, tighten this up, come on. Back down. You got 4 more. All the way up. Beautiful, 3 more. Again. Nice, 2, good, back down. Nice, last one, and then we're gonna go to straight leg hip extension. Last one, bring it all the way up, come on, bend the knee, 90-degree bend the knee, hold. Now relax. You're gonna do the same thing now with your leg extended. So you're gonna be in this position, Find straight leg hip extension. Think like a deadlift, an RDL, rather than a bridge. So the ankle's dorsiflexed, the knee is locked. Lift the entire leg up. Find glute hamstring. We feel hip extension there.
Yeah.
No compensation here, right? Bring the leg back down. Let's get another 10 reps there, and then we can wrap it up. All the way up, fully shorten it. We're still getting no lumbar spine, right? Beautiful, back down. That's 2, keep it going. Beautiful, as high as you can. Try to find true end range hip extension. 3, good. Back down.
For the hands?
Come on, hams are fine too. Hamstrings are fine. Find glute though, try to find glute. Good, you got 6. All the way up, man, come on. Keep your composure, 5 more. Beautiful. Back down, tighten the stomach, flex the lumbar spine. No compensation there. Bring it up, come on. You got 4 more, beautiful. Back down, I like the pause. Again, you got 3. All the way up. 2, good. Again. Come on, come on, come on, bring it up. 1 more. And relax. Questions on that? You see what we did there? We did passive stretching for internal rotation extension. We did isometrics in both directions. We did passive stretching ER extension in both directions. We did linear hip extension, lengthening your hip flexor, squeezing your glute. And then we did end range liftoffs with the knee bent and the knee straight. Yeah, so we'll go and do your other side, but